and culture, implications for health and behavior. And we are fortunate to have with us Linda Sprague Martinez from Boston University, Rosalind Negron, University of Massachusetts, and Dr. Carlos Eduardo Siqueira, College of Public and Community Services. And they are part of our UpNet group of grantees, and they were part also of our last conference, Methodological Approaches to Measure Culture, last March, and we thought that this was a perfect topic to include in our webinar series in commemoration of Minority Health Month during April. My name, I'm sorry, is Isabel Estrada. I do communications here at the Office of Behavioral and Social Sciences Research in the National Institutes of Health. And this is all I will say, and I will welcome our presenters and thank you all for joining us for the webinar. Eduardo? Oh. Eduardo, you are mute.
Okay, sorry, I was mute, but I'm not mute, sorry. You're going to hear from the three of us. Thank you very much for attending this webinar. Good morning or good afternoon, depending where you are. And I'm going to be the first speaking, and then you're going to hear from Linda and then from Rosalind. So I will try to make comments on the slides that you see in front of you, because I believe it will be a better use of your time. As you are seeing here, this is research exploring the relationships between transnationalism, culture, and health. And the outline for the presentation will be, as you see there, we're going to talk about the project aims, the partners that we have, the planning approach, since this is a planning grant, the results of the planning process, and the next steps. The specific aims, as listed there, try to describe what we're trying to do by studying Dominicans and Brazilians in the Greater Boston area, using a mixed method approach, meaning several methods that we are triangulating. It's an interdisciplinary planning committee that we built to explore the concepts of culture and its relationships to migration, transnationalism, as well as health beliefs and practices among Dominicans and Brazilians. And we use the process called Charrette, which will be described later. So the third aim of the project was a pilot multi-level participatory approach to examine these relationships between culture and health beliefs and practices so that we can further develop our full-scale study as we finish this project. These are the partners that we have. We have a couple of universities involved. As you see there, Boston University and UMass Boston. And before, we also had Tufts University. One of our investigators was at Tufts University at the time. She later moved to Boston University, but we still keep some students from her previous appointment there, and Amanda Wright, who is one of the managers of the project. And we have two community groups, the Brazilian Immigrant Center and the Dominican Development Center, which are two of the groups that represent these communities in Massachusetts, and particularly the greater metropolitan Boston area. One question that many of you may have is why Brazilians and Dominicans? Brazilians, for the reason they are the largest recent migrant group to the area. This is the second or first largest area where Brazilians live in the United States, depending on which data you use. But let's say at this point, 2015 is the first state where you have the largest population of Brazilians. Recent immigrants, meaning a few decades that they migrated to the U.S. And right before that, the other group that also has a similar pattern of migration, a little bit before Brazilians, are the Dominicans. So we basically decided to study the two most recent Latin American groups that migrated to the Massachusetts and to the metropolitan Boston area. They are very visible in the city of Boston and cities around Boston. And there are several good questions that we thought we could discuss by focusing on these two groups relating transnationalism, culture, and health. In particular, the fact that we know that these groups have practices and beliefs regarding transnationalism that are very interesting for us to explore, and it's somewhat a new way of studying the issue of immigrants' behaviors and knowledge and culture in the United States. The model that we use, many of you may be familiar with this one. It's been used in many different studies in public health and also in other sciences. It's a model that grows from the macro level at the society level to the micro level. So our purpose is and was to figure out the relationships that are multi-level, going from the individual, which is the most typical ways that people study culture, health, and immigration, to the society level. And another issue that we focus quite a bit of attention in this project is the level of relationships, or as you hear later today, social networks. Go into more detail on how people establish relationships among each other within these two communities, and also comparing the patterns that we might see between them and among them. Since we started to talk about culture, one very debated concept in the literature, we decided to adopt the definition that you see in front of you: shared knowledge and practices that emerge through dynamic interaction with and adaptation to socio-ecological conditions. The ways of seeing and doing that entail culture are learned and distributed in networks of social interaction. What I would highlight from this definition is we see culture as lived by real people. That means they change, culture changes. They're very important in defining what we do, how we do, what we believe, what we think. And we decided to focus this specifically looking at as part of a network event. In other words, culture is shared by people, is distributed by people, and we wanted to understand how this applies in the case of Brazilians and Dominicans. And some of the relationships that we're trying to understand through the ecological model and how they relate to culture has, as we saw before, different levels. For example, in the level of society, one of the issues that we decided to focus, and it was a very good decision for us to do, is to understand the role of religion, in particular for these two communities who are mostly Christian communities, and understand at the society level, what is it that these societies create in terms of religious beliefs and how that affects their lives. And of course, the relationships to health outcomes that we are also trying to study. At the community level, there are several issues there. What I would emphasize here is the issue of mobility, the issue of people being able to move from social different economic status in their communities, as well as the idea of communities interacting. So the idea of movement within communities. These two are examples of issues that we decided to include in our approaches at these two different levels. And as I mentioned before, the issue of relationships, very important in terms of understanding interpersonal influence, how knowledge and beliefs and behaviors diffuse, the issue of the distribution of knowledge and behavior within communities, understanding that, as we now understand it, the 21st century, that individuals don't behave or believe what they believe individually. This is typically a social network and a community event. And at the individual level, this is the most common approach that we still see in most studies, is about cultural knowledge, behavior, preference, values, or knowledge, attitudes, behaviors. This is the most traditional and still the most common way and approach for studying the relationships. And beyond the ecological model, what we believe is the innovation that we're trying to do is to look at this as a relationship between a sending country, in which case, in our case, would be Brazil and Dominican Republic, and the receiving country, which would be the United States, or Massachusetts, if you want to be more precise. And we want to understand these relationships at the different levels, as I mentioned before, but in the context of transnational interactions, which means we don't see recent immigrants as not having a past life and not having a future life that includes their previous lives in the country where they came from, and the future lives when in the countries that they might migrate back to. So we see this as a phenomenon that has to be well understood because it influences the day-to-day lives of the majority of those individuals, and actually not only the majority of them are at different levels. So our question is to what extent individuals within these communities are and behave in a way that we can call it transnational. So we thought this would be another level of understanding that is not yet very well studied in studies relating immigration, culture, and health in the U.S.
Great. So I'm going to talk a little bit about our approach, because what we set out to do was to develop a multi-level measure. And so how might we do that? We, as Eduardo mentioned, our team was transdisciplinary. We represented a number of different disciplines as we came together. And the approach that we employed was a planning charrette. And planning charrette involves three distinct phases. There's the preparation, education, and implementation. So I'll talk a little bit about how our preparation phase, how that was rolled out. The methods that we employed were mixed. We used cultural conversations, which are group discussions, during which participants are prompted to critically reflect on culture, health, and the context of immigration. Here, the discussion is led by a facilitator who serves as a participant observer in many ways, challenging participants to go deeper into issues and often bringing up the unspoken, that which is unspoken. The script is unstructured and it's not led by the facilitator, but more so the facilitator follows the group. We also employed photo voice in each community, and participants were trained, and they were sent out to capture images of the environment and the ways in which the environment and their living environment in particular influenced culture and health. They recorded and reflected on images and engaged in critical dialogue in a group setting. And finally, we used social network interviews, and what we did was we used the Egocentric software, where participants constructed visualizations of their social networks, and then we engaged them in explorations around the structure and composition of the network in the context of I can go back to that. Okay, so then all of that data was analyzed and synthesized into summaries, which is a planning charrette. And as you can see across the bottom of the screen, there's a model for a planning charrette, and where the data feeds the session, which then in turn there's critical reflection after the session feeding the following session. And what we did here is for each session, we brought in an expert in a given area, and we moved through each of the sessions with experts. So the themes that we covered were migration, transnationalism, mental health, and racial identity, religiosity, culture, transnationalism and health, cultural consonance, transnationalism and health, social networks, betweenness and stress, and then migration and mental health. And for us, some of the salient themes that presented throughout our planning, throughout our preparation phase, were related to mental health. Participants didn't necessarily, as they were thinking about health, they weren't focused on specific diseases, more so areas of well-being is what came out. So that's our focus there. So some of the things that we saw at the individual level related to beliefs and practices, with Brazilians there was a lot of talk around flexibility and adaptability and being able to kind of meld at different circumstances as different circumstances arose. Both populations talked about religion, religiosity, the church, that came up in terms of culture at individual level. Both also talked about hospitality and open home. For Dominicans, there was this constant theme that came up through the groups, that this idea of being a la orden, or at your service, and being here to serve. There was also places where the rejection of certain American practices came up for both communities. With respect to health, grooming and self-care came up in both, and the importance of taking care of self. Both talked about stress and anxiety, although it presented differently in each community. For Brazilians, there was a lot of discussion around stress related to immigration status, versus with Dominicans, there was more stress. Stress was spoken about in terms of discrimination, racism, where people were experienced. There was also stress for Dominicans that came up related to child rearing and conflict with the U.S. system of child rearing versus practices in the Dominican Republic. Both groups talked about changes in diet and dietary patterns. And for the Dominicans, they talked about it in terms of how in the Dominican Republic they had access to fresh foods, to healthy foods, but here they're much more costly. There, everything's organic, you grow it yourself, versus here, organic foods are more expensive. Dominicans also talked about isolation, and both groups talked about being overworked, and with that, in terms of heavy work schedules and working multiple shifts, came up ideas around lack of sleep and lack of leisure time. In terms of the immigrant experience, both groups talked about maintaining cultural ties around music, dance, literature, food, festivals, and religious events. Brazilians talked about the adjustment and adaptation, and changing cultural norms emerged within the Dominican group, and intergenerational differences came up in both groups. So with respect to the broader community and social environment, I'm going to share with you a couple of the photos that were presented during the Photo Voice activity. So this first photo that you see in front of you is a picture, obviously, of a cubicle. And as you look at it, you think, well, how this is obviously someone's work environment that's being presented. And this photo was taken by a young Brazilian woman who had recently completed a graduate degree, and she was very excited about her new position, and she talked about her cubicle, learning new things. At the same time, she talked a lot about stress and the pressure of always doing and having to always be doing. And a quote that she shared was, "I think that in the U.S., the system doesn't allow you to rest. It's about the opportunity cost. What are you losing when you're not doing something? If I'm watching TV, I'm wasting my time because I could be doing something. I could be reading a book or making $10 or whatever." So you become part of the system. It doesn't let you do what you want to do. In this next photo, you're seeing in front of you a church. And here, in terms of health, a participant shared, "I do believe that something good is happening here, all getting together, all believing in something. I think there's an important factor that makes you feel healthy, remain sane on different levels from..."
Just letting you know, you need to get your hair done.
From the connection that you make through having something to believe in, something to look forward to, and I think that's important. This next photo you see, I think, was one of my favorite photos that came up in our Photo Voice. It's obviously a picture of a telephone. And participants talked about how the phone is really important because it connects them with family back at home and friends, and they feel closer to home, and home being in Brazil because they have the phone and you can call anyone. They talked about being able, the first person, if you're feeling sick or you're feeling ill, the first thing you would do is call home to your mother in Brazil, let her know what's happening. But that connection back and forth was talked about in terms of the phone. And here you see on the Dominican side of the slide, what you're looking at is a pot of sancocho. And sancocho is a Dominican stew. It has a number of root vegetables in it, as well as different types of meat. And participants here in our Dominican focus group really honed in on, when this photo popped on the screen, they were all very excited, and they were looking at the pot, and suddenly they began talking about the size of the pot, and look how huge it is, and how enormous it is. And the comments were around Dominican cooking, and you would always cook a large pot of stew because in terms of how you would eat that food, it wouldn't be necessarily with your nuclear family that's right there, but more so people in your extended family might come by. You always want to have enough for 2 extra people in case a neighbor pops in. And so meals are shared a little bit differently. And the conversation, as it shifted, it really went to the fact, well, what does that look like here in the U.S.? And in the U.S., how not as many people pop by for a number of different reasons. the group talked about being more isolated. And so then they went on to say, well, what does that mean in terms of the amount of food that you have? Is that as you're feeling more isolated, you might be more likely to eat more, so you get fat. That came up in the group. But then also, as you reflected on the pot, it's a constant reminder when it's still full of who's not there. And so that was an interesting conversation. Okay, so the next photo, what you see here is a young person walking down the street in Boston, and a young man took this photo and talked about the style of clothes and the style of dress and how this was a stressor for him because he didn't necessarily like this style. But what did it mean to be a young Dominican man in Boston and having to, if you're not dressing this way, who are you trying to be, and trying to peer pressures, social pressures. Other groups and other folks in the group talked about, you know, struggles that they have with their children as their children were wanting to dress this way, and conflicts within the family that came up in the social environment. And the last photo that I have to share with you is a picture of a memorial, which you might see many of these in neighborhoods in Boston where Dominicans live, and that it's where someone was shot or killed. And a participant brought this in and shared it, that she was worried about the future. She was worried about youth, and it also caused her some degree of stress in terms of neighborhood violence and being concerned for her safety and that of her children as she walked outside. So the photos that we have, when we send people out to look at their living environments and think about their living environments, they not only captured the actual physical environments, but they also captured to a great degree the social environments that they experienced.
Hi everyone, my name is Rosalind Negron. I'm at the University of Massachusetts here in Boston, and for the next few slides I'm going to be sharing with you what we learned with regards to social networks. So really thinking about that meso level between the individual practices and beliefs, preferences, psychosocial factors, and then the broader structural conditions. And we found social network analysis to be particularly effective for looking at, the bridging between these different levels quite systematically. But specifically, we did it from an egocentric perspective. And what that means is that we measured the network of relationships that surrounded individuals, which is different from looking at it as a whole network approach in which it would be the network of a whole group rather than of one specific person. And there's a tool that we use called Egonet that helps us to gather these data that can take quite a long time to collect. And we ask people to provide the names of 30 people in their life, and we encourage them to think about
Linda?
two particular things.
Linda?
Linda?
I'm sorry. You need to raise your voice a little bit. It's very low.
Okay.
Thank you. Sorry about that.
No, that's fine. So I wonder if that makes a difference. Okay, how is this? Is this better?
Yes.
Okay.
Try to, project a little higher.
A little. Maybe if I take it up, would that help? Okay, now you can watch me holding a phone. All right, so we encourage them to think about the people in their lives who they feel impact their health, and whether positively or negatively, and then we ask them to also consider people who are not in the U.S., so their family and friends and other contacts in Brazil or the Dominican Republic. And then we asked them a series of questions about each of these network members, and finally they had to evaluate the relationships among each of their network members, and that's what generates this network graph that you see here. Oh, I see. This is how that works. I'm just trying to make the pointer work. Yeah, it's okay. I won't. All right, and so these visuals were presented to the participants with the names of each of the people represented by the nodes, and then we asked them about key individuals in their lives. We changed the image in order to highlight particular dimensions, for example, ethnic or racial identification, levels of felt closeness to their network members, whether their network member was in the U.S. or in Brazil or the Dominican Republic. The one that you see here is of a Brazilian participant. The orange nodes are the Brazilian network members, and the black nodes are the people here in the U.S. And then there was one individual who was in another country. I believe it was Puerto Rico. And so we sat with them and explored their network and thought about the impact of having friends and family and other contacts abroad on their adjustment to life in the U.S. and their mental health, on their cultural beliefs and practices, and then also thinking about, you know, their immediate social environment here in the U.S. So I'm going to show you a couple of examples of the sort of network graphs that we see, and then what we perhaps can learn about transnational processes and the impact that they might have on health. So these two images, again, are for Brazilian immigrants, and the orange are Brazilian contacts. I've resized the nodes, so in order to highlight seeking health advice from their network members, and that was rated on a scale of 1 to 3, or 1 to 4 actually, and 4 meaning like almost daily or very frequent seeking of health advice and other, you know, sort of conversation around health. So the bigger the nodes, the more that person was a source of health support or health advice, and the smaller the node. These were for individuals who they never would go to for health advice or health support. And what we found I mean, there was quite a great, you know, degree of variation in terms of the extent to which people sought health advice in their network members. We often found that there were a lot of people who only had sort of these select, you know, these select individuals who they would go to for that. It was oftentimes very close family members. But then we have people like this first upper graph here who had quite a lot of few people who they could go to for health advice. But what you see here in this particular network that looks very fragmented is that, and also transnational, is that this person had various subgroups or dyads that both here and in Brazil who she could go to for various sorts of social needs. So, and this is a common thing that we often find when we analyze people's networks, is that sometimes you find what you see there at the bottom, where people are part of social environments in which there's a lot of interconnection among network members, and that exerts particular sorts of influences and pressures on people with regards to health or cultural beliefs and practices, because oftentimes the very dense interconnected networks are, you know, sites of the circulation of sometimes redundant information, or tends to reinforce particular norms and values. But here with the woman's network up at the top, you see that she has various areas of her network that both here and in the U.S., with which she has specific sorts of social needs that are met by her interactions with those individuals. But what we see in general, and I'll just move ahead to a couple of examples of Dominican participants, is that what we see is that the social transnationalism that's evident in people's social networks is one that was very much bifurcated, in the sense that in general the networks weren't fully transnationally integrated. There were those individuals that were in Brazil or DR, and then there was those individuals who were in the U.S., and sometimes there were people who would bridge between those networks, but there was a sort of clear separation between these contacts, and we'll talk a little bit about that, what the implications of that might be. What we found for Dominicans, which was a bit different than for Brazilians, is that we had more Dominican participants who had no one in their network who was abroad, and this is what you see at the bottom here. All the nodes are black, meaning that they are living in the U.S., and this was a second-generation immigrant. And here in Boston, the general trend is that Dominican immigrants have been in the area and in the U.S. for longer periods of time, and so we have second and third generation Dominican immigrants, whereas for Brazilians, they're more recent, less second generation, and there's also higher levels of undocumented status. In our particular sample, more than 50% of the Brazilians who participated in our study were either undocumented or had some sort of visa status that was potentially sort of unstable. Okay, so in terms of some of the insights that we're learning, so looking at the networks is helping us orient to the the unique angle that we're bringing here, looking at transnationalism and its impact on health, but also in thinking about how cultural knowledge and practices are distributed between networks in a transnational way. In terms of the health perspectives, what we're seeing is that there is this sort of two worlds social transnationalism where people do experience some degree of separation between their life, their social life here in the U.S. and their social life in the Brazil or Dominican Republic. What's really important, though, in all of this that is very clear that technology has been instrumental for facilitating transnationalism in terms of the social dimensions of it. So a lot of our participants talk about using text messaging applications like WhatsApp, Facebook, emailing, in addition to the more traditional methods of just calling people on the phone. And as Linda had mentioned before, so the phone is sort of this smartphone in particular is this lifeline or this link to the social worlds in Brazil and the Dominican Republic, and this was especially the case for Brazil, for what we heard from Brazilians. And so what we get is that what we want to explore further in, as we develop this project is thinking about the extent to which transnationalism is protective to people's health. As those of us who study health know well, there's this notion that there's something protective about what, the sort of the cultures and practices that immigrants bring with them that wears away over time, especially when we get into the second and third generations, where there's something about living in the U.S. that just makes people unhealthy over time. And the transnationalism itself, whether it's with first or second generation immigrants and beyond, is a way for individuals to maintain a lifeline to their cultures, to those ideas and those practices that seem to be protective to immigrants. It's very clear from the interviews that emotional support is the key way that the transnational contacts continue to be helpful for their health, in addition to health advice. But many of the people who were abroad were family members, oftentimes, very close family members like parents, brothers and sisters, with whom they try to maintain weekly, if not daily, contact. And so this is an important kind of dimension of the transnational experience and obviously has very beneficial impacts on people's health. But what was also interesting for some individuals is that being here while maintaining some contact with people abroad was very freeing. So because there were some pretty close people back home, if they were back home, there's certain practices and certain aspects of their identity that they wouldn't be able to practice in a free way. And that separation and that ability to choose when to engage with their network members abroad was a source of freedom for them, and perhaps less stressful, especially, for example, in the case of one individual who hid his homosexuality from his mother in Brazil, and the fact that he was living with a man. And so these were things that he was not able to express freely in Brazil. But there's, as with many things, there's always this other side, and we recognize and we want to further explore this notion, especially in terms of the network dynamics of it, that transnational brokerage, so, being the one person sort of linking family in Brazil or the Dominican Republic with family or friends in the U.S. can be stressful. It's sort of negotiating the demands, the emotional, social, and oftentimes, in the literature it's talked about in terms of the economic burden or the economic demands, but here we're especially interested in the potential that the emotional demands on people transnationally can be a source of stress for these immigrants. Okay. So with regards to culture, and some of this is still in progress because we haven't fully analyzed the data we have for Dominicans, but the general pattern that we're seeing that's useful in terms of a comparison between Dominicans and Brazilians is that we see clear patterns of homogeneity and heterogeneity. So with regards to culture and ethnicity. So Dominicans networks tend to be more ethnically homogeneous, so meaning that Dominicans tend to have other Dominicans in their networks. Of course, there are generational differences. Younger Dominicans have more diverse networks. This is interesting. So, there's homogeneity despite the fact that Dominicans have been in the U.S. as an immigrant group for longer. And what this tells us, of course, is that there's something about, Dominican networks and values and beliefs with regards to Dominican identity that exert some really important pressures on continuing to interact with co-ethnics in a way that we don't see with Brazilians. And obviously that will have some important implications for a number of things, including health. Brazilians, on the other hand, despite the fact that they're more recent immigrants, tend to have more culturally and ethnically diverse networks, and they're in the cultural conversations and in social network interviews, there are more themes around cultural mixing and integration and actual desire to adopt elements of American culture or to build relationships with Americans, especially to learn the language. And we think this may be related to a couple of things. On the one hand, there just tends to be a certain sort of cultural value among Brazilians for flexibility and adaptability that we might find in Brazil itself. But what we're also finding is that the fact that Brazilians tend to be more undocumented, a very precarious sort of status, means that some of the Brazilians that we've talked to see greater value in integration and in learning English and sort of securing the social position as a way to counter their precarious immigrant status. So that's the stuff with regards to network, and for the remaining minutes I just want to talk briefly about our next steps with regards to developing a measurement or approach to examining the impact between the impact of culture on health, especially thinking about this in transnationally. And in fact, I'm not sure that developing new measures is the best way to describe it, because what we're doing is we're replicating studies that have already been done, but bringing these two core concepts and that are an important part of our study, so the networks and the transnationalism, to better understand cultural adaptation processes, individual adaptation processes, and the impact of culture and health. And many of you may already be familiar with Bill Dress's work. Much of that of his work on cultural consonance was actually developed in Brazil, which provides for us a very good model and a means to replicate some of what he's found for Brazilians to Brazilian immigrants more specifically. And what we're going to be doing is measuring culture through cultural consensus analysis. And this is, an approach developed within anthropology that measures the extent to which people share learned understandings about the world. And we want to do this, however, by looking at shared cultural understandings within social networks themselves. And then we want to further apply Bill Dressler's work on cultural consonance, but again, thinking about how variation within people's social networks with regards to cultural consonance, which is the extent to which people's behavior matches some model, some prototypical model for, for culture. We want to see whether variation with people's networks in regards to consonants also can be linked to particular health concerns. And in our particular study, what we've decided is that in next steps we want to really focus on mental health, in particularly depression and stress and distress. So I know that we're running out of time, so I just want to briefly say that we think that focusing this approach on social networks, again, is a way for us to be able to better understand how it is that culture, which is oftentimes understood as sort of this global thing that this emergent property sort of is that we sort of swim in, and sort of thinking about it in a very local way. Something that is dynamic locally, that is negotiated day to day in people's interactions and people's relationships, that as people kind of share cultural ideas, as they reproduce cultural ideas and practices, that they're constantly being transformed in relationships and interactions with other individuals within particular socio-ecological constraints. So we want to follow that further and understand exactly how that might work by looking at the distribution of cultural knowledge within people's networks. And I'm being told to stop. There are a couple of slides here that if people are interested in learning more about a particular approach, we would be very happy to, I would be very happy to elaborate and have conversations about. And I did want to make sure that we thanked the various people who have made our study more rich and complex. Of course, not the least Tracy and Magali Troncoso, who have been our community partners, but we've had wonderful conversations with researchers across various fields who've helped to inform our work, so we appreciate that. All right. Thank you.
Okay, thank you so very much. Now, I think we have a few minutes for a few questions, and they have been coming fast and furious through our chat. So we will be reading the questions so that everybody can hear them, and we will hear the answers from the presenters. Again, thank you so much to the presenters. What's the first one? So, Fatumata Sangay, sorry if I am murdering your name. Did you explore the Muslim community as perceptions and practices may be different? And he wanted to ask that to Eduardo. Oh, I'm sorry, never mind. We made a mistake on that. To anyone.
And I just wanted to clarify, that was the Muslim community?
Yes.
No, we didn't. None of our participants are Muslim.
Okay, and I think he actually, further down, he realized that that wasn't probably a good population for you guys to single out. So then Demetrius Parker asks, what is a social network visualization?
So it's a visual representation. So when people share data about connections of people in their network, it builds a matrix of the relationships, like whether person A and person B have a relationship, and then that matrix is visualized so that the researcher can better explore, sometimes what are very complex patterns, like structural patterns within people's networks. So these visuals are a way for a researcher and for participants to actually look at structure and composition within networks in a way that is easy for our human brains to process and gain insight from.
Okay, so we have another question from Kwekur. Again, sorry for the name mispronounced. Can you explain why the study focused on these two nationalities specifically? And also, can you confirm the population size? Was it 4 Brazilian and 4 Dominican?
Yeah, so we focused on Brazilians and Dominicans because Brazilians and Dominicans make up 2 of the largest immigrant groups in New England. And in terms of the population size in the study, I'm going to go back and clarify in the slide, but when you're looking here, so within the photo voice, there were 4 and 5 in each of the groups, and not including the community partners from the organization. Then within the cultural conversations, we ran a number of conversations in each group, and I believe it was 5 conversations, and there were a total of 40 and 48 participants in each group. And then within the social network interviews, we conducted 27 with Dominicans and 30 with Brazilians.
And just as so they're large immigrant groups here and share some characteristics, but I think the more important one is the fact that they're highly transnational, and there's some good literature in both groups with regards to the transnational practices. And so that was a major factor for focusing on them as well. Yeah.
Another thing that was interesting about both groups was that both groups are understudied, and they're also 2 groups that they're very racially diverse within groups, and so that was an interesting point for us as well to look at in terms of people's experiences in the context of the U.S.
Okay, we have another question from Charlene Jean. How can we effectively provide quality health care to a transient population?
Do you want to take a step?
Yeah, I think this is a very interesting question. We had a sub-study that happened, and Eduardo can speak to this as well, but we had a sub-study that happened with that a Tufts University student conducted over the summer that was focused on healthcare and healthcare seeking among Dominicans. And she conducted interviews with 17 Dominicans and providers in the Dominican communities. And the data was very interesting in terms of people's healthcare practices, because people were seeking care here, but they were also seeking care there. And they were receiving medications and remedies here, but also medications and remedies there, and sometimes bringing medications and remedies from the Dominican Republic to the U.S. And so I think for healthcare providers, it's really important, obviously, in order to meet your patients where they're at, but really understanding some of their healthcare practices and who they talk to in terms of, Rosalind talked a lot about networks and people's connections, but who do they talk to about care? Where do they go? What other types of remedies are they employing? But I'm going to let Eduardo talk to this one as well.
Well, the question is very general. What kind of transient theory you're talking about? These are not migrants, seasonal migrants that you have with the Mexican population sometimes in agriculture. These are people who came to the country to spend some time here. The transient period that some of them believe will be transient ends up being 10 years. So the question has to be very specific about what kind of transient period you're talking about. These are immigrants, not migrants. So as such, what you need to figure out to provide health care to them is what is it that they need in terms of what they brought with them from their countries of origin, which would be in this case Dominican Republic and Brazil, and how you can provide culturally competent and adequate health care for recent immigrants. And that would mean, in general, a very good primary health care system, which unfortunately that's not what we have in the United States. It's a bit better in Massachusetts, so we do better in Massachusetts than most of the country, but not good enough. We have ways to go in order to provide good health care. But your question was about how. How would be primary health care? That's the best approach that we should focus on.
Okay, we have another question from Judith Arroyo. Have you considered also studying alcohol use, which is often linked to depression and stress?
Interesting. interesting because, I mean, alcohol use has come up a bit in the social network interviews, and I think some in the cultural conversations, but actually in terms of the joy of interacting with people that you want to be with, and so it comes up in a very positive way with regards to socializing, maintaining relationships, and not so much in terms of abuse and having it be an actual problem. But I think it's something, for sure that we can.
And an interesting point also around alcohol use came up in the cultural conversations with Dominicans, but more so related to religious practices and holidays in terms of how alcohol use in the Dominican Republic has increased during religious holidays, which maybe in the past wouldn't have been that way. But it mainly came up with our older group. Our group of older participants talked a lot about it, but in the context of the Dominican Republic, not in the U.S.
Yeah, the evidence that we have as far as Brazilians are concerned does not show a relationship between depression and alcoholism. There is some overconsumption to deal with depression by some people, but the evidence that we have doesn't show the typical relationship that people consider, which is alcohol abuse leading to depression. We may see a few people who actually have depression and use alcohol to treat their depression without medication. But it's not an overwhelming evidence. It seems to be more of a marginal number of people who have depression and also consume higher levels of alcohol. For example, through binge drinking, which is culturally acceptable by many Brazilians over the weekends to celebrate parties. Binge drinking is not considered a phenomenon that's related to alcoholism culturally. But as far as a clear association between alcohol and depression, those communities, is not clear that it is the issue.
Okay, we have another question, and actually we have many questions, so I don't know if we will be able to cover them all. But Ola Rostand asks, what is the racial makeup of this study? Are the people from Brazil white Brazilians or Afro-Brazilians?
White Brazilians or?
Yeah. Well,
Afro-Brazilians.
So this would be, the data that we have would be on self-ascription of race, and more than half of Brazilians identify as Blanco. So we use both the U.S. Census categories and the categories, the typical categories used in Brazil, and so more than half identify as white, and a very small, I think less than 5% identified as black.
Or Afro-Brazilian.
Or Afro-Brazilian.
Okay. Another question. Chip Hughes asks, did you specifically focus on work status as impacting on social networks?
Work status.
Like in regards to, like,
well, obviously, it is a written question. I'm assuming work status. I'm assuming if they were employed or unemployed or.
Most of the people that we spoke to were employed. And then in fact that was an important. I think that when we were thinking about recruitment and sampling, we were actually, especially for Brazilians, but I think, we decided to do for Dominicans as well. We thought about occupational groups here, and Eduardo can talk more about this. The major occupational groups that we had thought of with regards to recruitment were construction workers and domestic workers and professionals.
Yeah. Unemployment is not a problem that's prevalent in the community. What we have is actually many people working several jobs, and they may have seasonal jobs, but unemployment is not really an issue that's considered a problem. So if you are thinking theoretically, yes, theoretical unemployment would affect this, but what we see here is most people that we sampled were employed, and most Brazilians where the sample came from are employed. The question would be how many hours. Some of them work over 40, 50 hours, some of them work part-time, but they all want to work full-time. So I don't think there is a strong case to be made in terms of employment versus unemployment. It's more about how intense and how many hours of work people work as it relates to the ability of keep their social network.
Yeah, and then for just really quickly, for a lot of people, you know, we asked them questions about how they met each of these individuals in the social network, and you know, at work was one of those categories. So we see very clearly that a lot of people who are members of these networks are people who they met at work and continue to interact with at work.
Mm-hmm. And just building on Eduardo's point around employment, for the Dominicans, the majority of people were employed as well, but one case would be the pay rate was always a concern in terms of people having to work multiple jobs because of the industry that they were in. We talked to people who were professionals, but then when we talked to people who were in a working class group, they were oftentimes lower wage workers, and so they had to have multiple jobs. So people worked a day shift and a night shift with a break in between, and so sleep was concerned as it related to employment.
Okay, the audience is asking for you guys to use the receiver because it's very hard to hear some of you. So then I have another question from Pretty Gaghawk. Can you describe your recruitment procedures? What methods did you use to approach potential recruits?
Okay, so our recruitment procedures, we worked with our community partners around that, the majority of our recruitment. We used snowball sampling, and for the cultural conversations, I'm getting a little feedback on the receiver, so I'm sorry if I'm not clear. For the cultural conversations, we first broke into groups in terms of 1.5 generation and then first generation who were elders, as well as a group of professionals, and then a group that was folks who were in low wage jobs. And then for the social networks interviews, we also made sure we had a mix of first generation and generation 1.5. And then from there, it was convenient sampling and working through partner networks and different networks throughout the Boston area.
Yasin Patel asks, how did the number of years living in the U.S. impact the number of transnational relationships present in a network?
Yeah, that's a really good question, and that's one of the things that we're still having to explore. But we see, you know, one of the things that we see is that there are clear differences between those who are immigrants, first-generation immigrants, and those who are second-generation immigrants. The second-generation immigrants tended to have much less. It's sometimes not at all. For Dominicans, all of the second-generation immigrants that we looked at had no transnational contacts, and it's not to say that they don't, but oftentimes, you know, these were young people, for example, and so they might leave that transnational kind of relationship maintenance to their parents and their elders, and their sort of focus in daily life and daily interaction is around school networks and sort of local networks of interaction. So that's all we can say about that particular question now, just because we haven't looked at how this breaks down for a number of years in the U.S.
Okay, we have a question now from Ana Maria del Rio González. Are there standardized methods to analyze these social networks? Can you say something regarding sample size requirements for this type of analysis?
Well, so the egocentric approach, you know, a lot of the sampling requirements for that are very similar for any study that you would have in which you're basically, one way to think about this is that the social network measures that you would get from looking at the network, so if you were interested in incorporating quantitative data into a data set, these social network measures would be one other column in a data set in which you can have any number of individuals that you would think you would need in order to answer your research question or to reach statistical power, depending on what the variables are you're studying. The caveat to that is that egocentric network analysis is very time-consuming and sort of labor-intensive for the participant. As you add more and more people that you would like for them to kind of list. So for us, we were 30. We actually started at 40, and it was taking people a very long time to complete our survey, like more than 2 hours. So we reduced the number of network nominees that we asked for to 30. So the consideration then is how much time do you have for participants to invest in that particular approach? If it's not a lot of time, then your sample size would have to probably be smaller to be able to at least get some of the insight, especially all the insight that comes out of the qualitative analysis of the visualizations. So that's something to keep in mind. Otherwise, if time or money is not a factor, you can, depending on what your research question is and what you want to accomplish, you can have quite large samples. In terms of measures, so within the field of social network analysis, there are a number of metrics to specifically look at structure, things like centrality and density, for example, and subgroup formation. And so there are standard measures within the field that can be applied to an egocentric network as well.
Okay, we only have 3 more questions, so if you indulge us, we finish. Everett Long asked, from the CDC, she asked, were you able to analyze if socioeconomic status has any effect on transnational networks?
Right. So Linda, so I think not yet. And I'll let my colleagues speak to this as well. But to the extent to which the undocumented status is associated with economic status, we do see that obviously, especially for the Brazilians, that dimension of transnationalism that has to do with returning home at all, or especially on a regular basis, is very much limited. So that's where this sort of concept of social transnationalism becomes much more prominent, because typically transnational, there are these sort of indicators of transnationalism that we look at that relate to economic remittances, for example, people sending different products back home, and also visiting. For many of our Brazilian immigrants, that is not an option, and that's where technology really comes to play. So that's if we're not able to really say whether undocumented status is actually translated to kind of lower socioeconomic standing, but maybe, do you want to speak to that?
Yeah, we do have evidence about this relationship well established in the literature by Alejandro Portes, which basically claims that the higher you are in the socioeconomic status, the more connected you are, the more transnational you are. Our research will try to balance this idea with the data we have. At this point, we don't have enough data, nor is our sample size large enough at this point that we can claim a clear relationship. But as was said before here, the fact that people are able to connect through internet, through cell phones, make very possible for people with low incomes to be able to connect with people on a daily basis, weekly basis, as far as they want, because pretty much everybody has a cell phone here. So we wouldn't see that at that level. We would see differences in terms of remittances. We would see difference in terms of how many times you travel. But you wouldn't see other, or for example, if you want to go towards the economic investments and philanthropy in the country of origin, all the measures that people use to see the differences, we wouldn't be able to see with this small sample. But the patterns seem to be similar in terms of the ability of connecting through the networks that they have.
And then the last question, speaking of large sample sizes, ask, how do you plan to extrapolate these results to a larger U.S. population to improve health care overall? And that's a simple question, so I'm sure you can answer that in Split second.
Well, I mean, I think that this is a planning grant, a pilot grant. It's planning. Being a pilot grant. A lot of what we're doing is actually proof of concept. It's sort of exploring what's doable, what's possible, and in the future, you know, we can hopefully have the resources and the time to explore, you know, to use these methods and explore some of these questions with larger samples, so that we can say something, you know, more generalizable. At this point, we can't.
Well, that's our last question. I would like to thank the presenters again, and thank you all for attending the webinar. All of you who registered and who participated will receive any further information we may gather about the webinar. We also plan to compile these questions, send them to the presenters to see if they want to add or elaborating any of those, and then we will send the questions back to you for reference. And we also will send you a link to a great blog post that they wrote about their research that we have in our on our website as well. And the slides as well. I'm sorry. Okay, that would be it from our side. Thank you again, Linda, Eduardo, and Rosalind. Excellent presentation, and thank you all who participated, and keep tuned. There will be more of this to come. Thank you.
Very much.